Come in.
Hi, how you doing? I'm Nick. I'll be your nurse today. Can you please give me your name and date of birth while I wash my hands?
My name's Paul Galen. I was born 7/13/1964.
Okay, thank you. So would you agree that the environment is safe and private?
Yes.
Okay. So today I'll be performing a general survey on you. To start, I'm just going to assess your posture. I can see that you're sitting upright with no issues. Your facial mood is appropriate for the situation. In addition, can you please tell me around what time it is?
Approximately 6 o'clock.
Okay. So after doing the general survey, I can see that his posture is normal and he is alert and aware of the scenario. So next, I'll be performing a neurological and musculoskeletal assessment. So, do you have any trouble seeing?
No.
Are you sensitive to light? Are your eyes sensitive to light?
No.
Do you have any muscle weakness or joint pain?
No.
Okay. So first, I'm going to start by assessing his eyes and perla. Perla is pupils equal, round, reactive to light, and that they accommodate. So first, I'm just going to be looking in your eyes and measuring the size of your pupils. So after checking the size of the eyes, I can tell that they are both equal sized and round and measured at 4 millimeters. Next, I'm going to see if they're reactive to light. So if you could please just look at my chest, and I'm going to be shining the light above to see if they constrict. So after assessing with the pen light, I can see that his pupils do constrict within light. So next, I'm going to be checking accommodation. So to do this, I'm going to, if you stare at the pen, I'm going to move it farther away and closer. So accommodation is that the pupils and the eyes converge on the pen together bilaterally. So next, I'm going to be assessing muscle strength and weakness. So, Mr. Gaiman, can you please squeeze my fingers with both of your hands? Okay. So after assessing that, his hand strength was equal bilaterally. So can you please stick out your hands like this for me? Can you resist my force down? Okay, thank you. Can you please flip them over for me? And now can you resist them up? Thank you. So now, I'm just going to move this chair here so you can put your legs up on it. Can you please put your legs up on it? So now, can you please resist me pushing up on your foot? Actually, I'm going to do them bilaterally together. And now can you do it? Thank you. So I'm going to move the chair. You can put your feet down. So after assessing his muscle strength in the upper and lower extremities, they're equal and strong bilaterally. Some older adult findings you might see are muscle weakness, joint pain, and a kyphotic curve in the back. Next, I'll be assessing your respiratory system. Do you have any trouble breathing?
No, sir.
Do you cough at all?
No.
Any wheezing?
No.
Okay. So now I'll be assessing his lung sounds, anterior and posteriorly, which is the front and the back. So Mr. Gaiman, I'm going to be placing the stethoscope on your chest, and every time that it touches the chest, can you please take a deep breath in through your nose, out to your mouth?
Okay.
Okay. So. Okay, now I'm going to be assessing the back. So could you please lean forward for me? Same thing as the front. When I place the stethoscope on your back, can you please take a deep breath in through your nose, out through your mouth? After assessing his lung sounds, I did not hear any crackles, rhonchi, or wheezing, which is a normal adult finding. So next, I just need to check your brachial pulse, which is on your arm. If you please pat the figment of your wrist. Okay. After assessing his pulse and respirations, his pulse is at 88 beats per minute, which is normal, and your respirations are 18 breaths per minute, which is also normal. So some older adult findings you may find are decreased tidal output, trouble breathing, and altered gas exchange. So next, I'll be assessing your cardiac system. So, do you have any chest pain?
No.
Do you have trouble exercising?
No.
Do you get out of breath when doing simple daily tasks?
Not at all.
Okay, great. So now I'm going to be assessing your heart sounds. So just sit tight. So first, I'm listening to the aortic at the second intercostal space. Next, I'm listening to the mitral valve. Next, I'm listening at Erb's point. Now I'm listening at the pulmonic valve. And now I'm listening to the apical pulse at the fifth intercostal space at the midclavicular line. Now I'm just going to listen with my bell of my stethoscope. Once again, aortic, mitral, Erb's point, pulmonic, and the apical pulse. After listening to his heart sounds, he has normal rate and rhythm, which is a normal adult finding. Next, I just need to look at the, I just need to listen to your apical pulse for a minute. Okay. After listening to his apical pulse for a minute, his pulse is at 88 beats per minute, which is normal for an adult. So I'm just going to assess your lower extremities for edema. If you please put your feet up once again. So I'm going to put your feet down for me, please. So after assessing, there are no signs of edema, and next I'm going to check your capillary refill. Can you please stick out your hands for me? Okay. His capillary refill is within 2 seconds, which is normal and healthy for an adult his age. Next, I'll be assessing, normal adult findings, older adult findings you might find are decreased heart rate and chest pain and trouble performing exercises because of decreased cardiac output. Next, I'll be examining your peripheral vascular system. So to start, do you have any tingling or numbness at your fingertips?
No.
Or
No.
Do you have are your hands cold or extremities cold usually? No?
Not at all.
Okay. So now I'm just going to assess your pulses. First, I'm going to examine for any varicosities. He does not have any varicose veins or indices. So now I'm going to assess his pulses. So if I could please have your wrist again. So the radial pulse is present. Actually, I need to check both of them, sir. So after assessing his radial pulse, they are present, +2 bilaterally, which is normal. Next, I'm going to assess, I'm just going to put your feet up real quick.
Thank you. Both of them?
Yes, I need both of them. Thank you. So now I'm assessing his pedal pulses. So both pulses are present at +2 bilaterally, which is normal. I'm just going to put your feet down one more time. And now I'm going to be assessing your posterior tibial pulses. So after assessing his pulses, the posterior tibial pulse, they're equal and bilateral. They're present at +2, which is a normal finding. So next, I'm going to, some older adult findings you might see in the peripheral vascular system, they might have decreased blood flow to the extremities, causing them to be cold due to cardiac output, and it also may experience numbing of the hands and feet. So the last system I'll be assessing is your abdominal system. So, do you have any trouble swallowing?
No.
Do you have any constipation?
No.
Do you have trouble moving bowels?
No.
Okay. So first, I'm going to auscultate your abdomen. So, you just sit there, and I will place my stethoscope on your stomach.
Alright.
So first, I'm going to assess the right lower quadrant. And then I'm going to move clockwise. So I'll go to the right upper quadrant, the left upper quadrant, and then the left lower quadrant. Okay, so after assessing his bowel sounds, they are present in all 4 quadrants, which is normal. So next, I'll be percussing your abdomen. So I'm just going to be lightly tapping on your stomach. There are no abnormal sounds coming from the stomach after percussing. So now I'm just going to be palpating your stomach. Can you please tell me if you feel any pain or tenderness? Any pain or tenderness?
No.
Any pain or tenderness?
No.
How about here?
No.
How about here?
No.
Okay. So after palpating his stomach, there are no tenderness, which is a good sign. That's normal and healthy. So next, some older adult findings you may see in the abdomen might have, well, first I checked his abdomen. It is not distended or in any irregular shape. So older adult findings, they might have constipation due to decreased peristalsis. In addition, they may have trouble swallowing. So that is the end of our survey. I'm going to wash my hands and document my findings.